Well, Southeastern Idaho emergency personnel put their disaster skills to the test this weekend. I'm Bree Clark. Thank you so much for joining us. In a simulation, they had to apply information they learned at this year's Readiness Conference to major crashes along I-15. Eyewitness News reporter Dennis Valera shows them in action.
Despite just being an exercise, local emergency responders treated this simulation like any other incident. Staging 2 bus crashes at different times, local hospitals part of Idaho Public Health District 6 were tasked with overwhelming patient loads. As their patient beds neared capacity, they had to transfer patients within the region without compromising anyone's care.
Now, the point of this functional exercise is to make sure everyone knows their role, knows how their organization works, and, most importantly, how to effectively communicate with other regional health institutions in this big of an incident.
Nick Scarborough designed this exercise and says proper communication is a learned technique. It can't be learned during an actual disaster.
Relationships that you establish with your fellow responders are really going to be put to the test in an emergency, and you just don't have the time to establish them when you're trying to save lives. They have to be there beforehand.
Participants use cell phones, ham radios, and an online crisis management system to communicate with each other. Patients were tracked using these patient tracking sheets, which were designed by Scarborough. A number of obstacles were introduced as time passed, from overloaded phone lines to needing more nurses. Luis Perez at Power County Hospital says after this exercise, he's confident in handling these situations.
Where 2 major freeways run through, and we've got several highways, and summertime's coming and we get a lot of tourists, so I mean we have to be ready. We have to be prepared.
In Fort Hall, I'm Dennis Valera.
And District 6 includes 8 counties, and all of those who participated completed the exercises and objectives.